Although many people have a family history of cancer, only 5 to 10% of cancers are due to genetics. Genetic counseling can help you learn more about hereditary risks for cancer and provide important information for you and your family. Here now with more about genetic testing are Emily Kuchinsky, a certified genetic counselor with MedStar Health Cancer Network, and we have two patients. We've got Jim and John Kielek, as well as their family that's joining us now to talk about genetic testing. I want to start with you, John. You decided to get genetic testing sort of at the behest of Emily, but this comes after some bouts with cancer. Can you tell us about sort of your journey here?
Yeah, I first had it in 2007, Christmas Eve actually, and then it came back in December of 2010. So I had my entire colon removed, and I was doing follow-up testing every so many years like I'm supposed to, and one of those trips I ran into Emily and she said, you might want to do genetic testing. And I thought, well, it was a little bit late for me, but she's like, well, if you have children, it's very important to let them know going forward if they are positive for it. They need testing sooner, it can save their lives. So.
And Emily, what about John's bouts with cancer made you think, you know what, you should do genetic testing? Because that's not always the case.
Yeah. Like you said, only about 5 to 10% of colon cancer is inherited. I was concerned because he was diagnosed young with his first cancer, and then it's not rare for people to get colon cancer once, but for him to get a whole new second primary colon cancer, it wasn't a recurrence of that first one, made me concerned that maybe he had a genetic mutation underlying those colon cancers.
And you found out that he had Lynch syndrome. So what exactly is Lynch syndrome?
So Lynch syndrome is actually the most common cause of inherited colon cancer. It increases a person's risk 5 times higher than average, so up to an 80% lifetime risk to get colon cancer. And women also have a dual issue. They're at increased risk for endometrial or uterine cancer. Okay. We also can see increased risk for ovarian cancer and stomach and other GI cancers.
And so I know that you decided to get tested as well, Jim, and the rest of your family, they're not mic'd up, but talk about who you brought here. You've got Mom here, and who else do we have behind us?
So Mom and my sister, the oldest, Evie, and next to her is John's son, Brian, and his son, Brian Jr.
Brian, yeah, they made it easy for us, Brian Jr. Right. And so the whole family then got tested, and what did you find?
Fortunately, everyone except John was negative for Lynch syndrome.
Wow.
Which is, there's one still to be tested, his daughter, but everyone was negative, which was surprising, but a good surprise.
It is a good surprise, and armed with that knowledge, talk about how empowering that is for you as a family to now know what you're medically predisposed, is what I'm trying to say, to. I mean, I would think that would give you more of a peace of mind whether you have it or not, because you know how to treat it.
You would think so, but actually this Lynch syndrome business in cancer started well before John, with my mom's mom, who had colon cancer in her 80s and died at 92, wow. Mom having cancer in her 70s, and then John having cancer in his 40s. So even though he's positive and we're negative for Lynch syndrome, we're still not off the hook for colon cancer, and our risk is still higher than someone who's had no family history at all.
So Emily, how is it treated then, Lynch syndrome?
Yeah, so if we find out when someone's young that they have Lynch syndrome, we recommend starting colonoscopies at age 25 and then repeating them every 1 to 2 years. And just to put that in perspective, most people start with colonoscopies at age 45 to 50 and go every 10 years. So you start much younger and more frequently. And for women to deal with those GYN cancer risks, we recommend removal of the uterus and the ovaries once they're done having children.
So someone's going to watch this and wonder if, you know, this could be going on in their family. How do they go about getting tested? What do they do?
Well, I would recommend they ask their primary care physician or another one of their healthcare providers for a referral to a genetic counselor, and they can sit down and draw out their family tree like I did with this family, and look for those patterns of early onset colon cancer, maybe endometrial cancer and other cancers that would suggest something like Lynch syndrome. And then they can undergo genetic testing if needed.
Well, I want to thank you all for being here and speaking as a family. To get more information regarding genetic counseling or to set an appointment, call 443-777-7656. You can also learn more during MedStar's colorectal house calls on March 18th and 20th right here on WMAR 2. We'll be right back with more Midday Maryland right after this. Stay tuned.